Welcome to a new episode of Parenting and You with me, Dr. Shefali. Sometimes our children exhibit quite dangerous behaviors, some things that scare us, and we often don't know what to do about it. It brings up great anxiety when we see our children suffer and deal with problematic behaviors that we have no clue how to help them with. Coming up next is a mother who's dealing with a big red flag behavior with a daughter who is harming herself. Joining me now is Angelica. She says she's struggling raising her 14-year-old daughter who has been lying and threatening to run away. Angelica, welcome. Tell us about your struggles with your daughter.
Yes, I have a daughter, 14 years old, and she's been lying and threatened me to run away and cut herself. And she's been struggling with the depressions and anxiety. But every time I asked her what's wrong and she didn't want to tell me anything, just saying that you don't understand. So, and I found out that she cut herself in her arms so many times. And I asked her, they said, did you cut yourself? And she said, no, it's my bunny doing it, So then I keep asking her, no, this is not, bunny doing this, So I finally told me, yes, I cut myself. And I asked her, why did you do that? Tell me anything if you have a problem. She said, you don't understand, So, and then every time I come back from work and she just look depressed, So I take her to somewhere, she just still look depressed. So I didn't know. Every time I asked her, she's just like, I'm okay, But then sometimes she cry, I understand. So I asked her, she said, I'm okay. You don't understand.
I understand. How long has this been going on?
Maybe like a year.
Has she seen anyone professionally?
Finally, I asked because she cut herself, so I worry. So I asked her to talk to therapists, and she agreed with that. So yeah, it's been once a week now. She's been look at the therapist, But it didn't help her though much because I saw her fresh cut last time in her arms again.
Mm-hmm.
I checked her social media message to her friends. She's like, I'm going to run away. She didn't tell me, but she just tell her friends that.
So when did you notice that your daughter was depressed or anxious and things were difficult between the two of you? When did you notice that there was a disconnect? How many years ago?
When she kept really quiet, suddenly she not talk to me before. She just talk to me everything, Now she's just suddenly quiet, always in the room, always in her iPad, and she just look depressed. And I know that until she cut herself.
I understand. So here's the thing, I call these behaviors red flag behaviors because they are a call for help. They are a sign that your child is really suffering. So like you, many of us parents ask our children, tell us what is happening, what's going on, why are you doing this? But here's what I want to tell all parents. You don't need to ask why. You know why? Because it's clear. The why is really clear. She is suffering. She is in deep emotional pain. You don't need to ask why. You just have to know what it is. It's deep emotional pain, misunderstanding, and fear. And she's clearly telling you that she's afraid that you will not understand. I know that feels really anxiety-provoking. I can see that you're getting emotional. So let me ask you, in terms of logistics, has anything else happened in the family lately that is different or that is stressful that we can call a trigger for her depression?
Not that I know, no. Everything the same.
Okay, so there's nothing in the external world, but
Right.
but you would say over the last 2-3 years, she's had this?
Maybe a year.
So since she turned a teenager, since she became 13. And that's again very common when children turn from children to teenagers, though she's still a child, they go through such a big hormonal and chemical shift that things really shift on an emotional level as well. So when our children are crying to us saying, I need help, mommy, you're not understanding me, we quickly fix them, right? So you sent her to see a therapist. But really, we have to do the work within ourselves. So have you and she gone for family therapy together? Or have you tried to understand what you could be doing differently to help her?
No, I haven't gone to therapist. Thought of us, only her. So, yeah.
Yes. So that's where we as parents typically go wrong, where we look at the child as the child to be fixed, right? We just think that, oh, if they go and become better, we'll all be better. But your child is also communicating. Our children are always communicating to us what they need. She's telling you, mommy, you don't understand me. Mommy, you'll never understand. So let me ask you now, because you've been so brave to come to me right now. What do you think you're doing in your parenting that is making her feel ashamed or afraid? Were you a controlling mother? Were you a tiger mother? Were you a strict mother?
I think I'm kind of strict to her, like on the screen, like, I time her like only 2 hours a day, on the screen. And then like, don't go to sleep too late, something like that. That she hates too much. You want to stay up. So, and then every time she do something wrong, I kind of yell at her.
Right.
So could be that's the problem.
So go back to her childhood when she used to throw a tantrum or be disrespectful or forget something. What were your reactions back then? Because what we don't realize is that our teenagers seem to change overnight, and they do on one level, but also how we treated them as children is how they are as teenagers. You understand? So let's go back to her childhood. What kind of a mother were you as a child's mother? How were you when she was young?
Yeah, I think I yell at her a lot. Would be that the problems. Yeah, like sometimes she spilled something. I was like, can you please just be careful? Kind of like that.
So you were like what I call a fighter mom, like where if anything went wrong, you were fighting or angry or aggressive, would you say?
Yeah, yes.
And
yes.
Angelica, were you raised by parents who also yelled at you a lot?
Yes.
So talk about that for a second. How were you raised? Because that's what you're repeating in your own parenting.
Yeah, my parents very strict. I always have to get good grades and study. If I got really bad, they yell at me. So like if I speak up to them, they yell at me back.
Oh my goodness.
I cannot speak up to them.
Right. So do you remember feeling disconnected from your parents?
Yes, in some points. Yeah, but not long because I'm kind of scared to them.
You're scared of them.
Yeah, I cannot make a mistake.
Oh.
If I make a mistake, they yell at me. I cannot speak up.
Even today, as an adult?
Today, sometimes, yeah. Sometimes, like, they got mad at me if I show my feelings to them.
Yes.
Yeah, and then sometimes, when I had broken last time and I cry, and they ask, like, why you cry? Like, what's the point of crying? Like that.
You don't feel safe with your parents, and you don't feel like you can express your feelings. Yes.
Sometimes I ask them, why I cannot do this? And they're like, you're a child. You have to listen to me. Like that,
So you remember how it was to grow up with people that you could not talk to. Your daughter is experiencing the same disconnect from you.
I can see it now. I realized it now when I'm talking to you. Thank you. I didn't know that before. Now I can have to teach myself first.
Yes. So here's how we change ourselves, right? First, we become aware of how we are repeating a pattern. The next way to change it is to ask ourselves, what would I have wanted from my parents? What would have made me feel safe? What would have made me feel understood and confident and secure? So let me ask you, Angelica, what would you have wanted your parents to do with you to make you feel safe? What is something they could say, or how could they be with you? Tell me.
I wish that they can accept who I am, like, you need to be this support us. Like, I have to be certain things to us. Like, I wish they can like support me whatever I want, If I want to be a doctor, they can support me like that, Even though I want to be a garbage, working in the garbage business, supposed to support me.
Yes.
Sometimes it's like, what are you doing that for? Like.
Right. So what you're saying is that you wish your parents supported you if you wanted to be a doctor or a garbage person. It's the
Right.
same thing. You wanted your parents to see you, and that's what we all yearn for. Each human enters relationships for only one core need. Do you see me? Do you validate me? Do you accept me? And that's what your daughter is screaming for. And she's so scared to tell you. So she's cutting herself. She's harming herself because she's so afraid to share it with you. You understand? So
Yeah.
she's showing you by harming herself that she's screaming inside because she feels controlled by you. She feels afraid of you. So now that you've realized this, do you see how just asking her is not going to be enough?
Yes.
She needs you to communicate to her something deeper, something like, I see you're in pain. I understand that you're upset with me. I see that you're afraid to talk to me. I was like this with my parents. I am so sorry. I haven't been present. She needs your heart. She doesn't need your questions. She needs you to connect to her pain.
Yeah, I understand. I aware that now. Yes, I will have to do that.
Why does a child want to run away from us? Why do children lie to us? Why do children harm themselves? Why do children hide from us? It's only for one reason. The reason is they feel their parents are totally shut off from them. They feel that their parents totally disapprove of them. So all your yelling, because you got that from your parents, you have to have compassion for yourself. You learned that from your parents. You didn't know.
Yeah, it's automatic.
It's automatic, exactly. You were yelled at by your parents. You yelled at her, but she's very sensitive. She's very fragile and she is falling apart. So this is a huge red flag for you to stop, to pause, and to really connect with her and show her that you're not just a parent, but you're a human being with a heart. And you understand her pain and you're willing to acknowledge your mistakes.
Yes, I agree with that. I need to have more compassion towards her. Like, even though she make a mistake, I just, that's okay, I have to tell her that it's okay. Don't worry about it. Everybody make a mistake.
Yes, but right now, because this is a red flag behavior, I want all parents hearing to understand that when behaviors become self-harming, when children are threatening to leave and run away, those are not simple acts of defiance. Those are red flags. And we need to answer the red flag with a serious wake-up call. And your wake-up call is that it's not just about sending her to get fixed. It's you need to show her that you acknowledge your mistakes and you need to be in therapy. And the both of you need to go to family therapy. You see, it's not fair that we're just treating her like the problem. The relationship is a problem, not the child.
Yes, I understand now. Yes.
Okay, so take action. Take action right now. Today, you need to show her that you are deeply concerned and you're willing to acknowledge your mistakes and get the help you need.
Yeah, I do need help.
Good, good. Well, taking the first step by coming here is you showing us all and yourself that you're willing to make a change. So I'm really proud of you. And don't stop here. Make sure you get the help you need.
Yes. I always follow you and look at your Instagram, doctors.
Thank you. I'm glad.
So many wisdom, words and knowledge. I really appreciate. I learned a lot from you.
I'm so proud of you. I'm so glad. And I have a coaching institute with lots of coaches, so we can refer you to someone if you need the help, okay?
Oh, yes. Please. Thank you. I need to have a good relationship with her before she become adult, I want to be like every step until she's getting older.
And you can share with her how you grew up and how hard it was for you and you don't want to repeat the same mistake.
Yes.
Thank you,
Yes.
Angelica. Thank you so much for being transparent. Thank you so much.
Thank you. Thanks so much.
When our children suffer, they typically find ways to communicate their pain. And some of the ways they find are through what I call red flag behaviors. They may start drinking or engaging in substances, missing classes, running away, not coming home till really late at night, or self-harming behaviors like cutting. These behaviors alarm us parents, and typically we go into control mode and we punish them or we yell at them or label them as bad. What I want every parent out there who may be experiencing these behaviors in their home to realize is that these behaviors cannot be punished. They need to be helped. These are your ways of your child crying out for help. They are trying to tell you, Mommy, Daddy, please see me. I'm in pain. Help me. So I'm here to let parents know that when you observe these behaviors, take charge, take action, reach out for professional help. Don't waste a minute. Your child needs the support and they need you to step in and provide it for them. Coming up next, I'll talk to parents of a 14-year-old who's addicted to his video games and they just don't know what to do about it. Joining me now are Kim and her husband, Michael. They're struggling with their 14-year-old son who has autism, some ADHD, and they say he's addicted to his video games. So Kim and Michael, welcome. Kim, tell us your daily struggles. I know that this is causing you a lot of stress.
Yes, the gaming is getting way more, and the problem is around his friends. So his social contacts are through the internet and through gaming. So it's really hard, it really struggle for me to get him off because I know it's not healthy. But yeah, we have a lot of arguments about this topic.
And how many hours would you say he's on the games every day, average?
I think before dinner, 1.5, 2 hours, and then after dinner until he goes to sleep.
And is it disrupting his ability to be with the family? Like he doesn't want to be with you guys much? He's trying to run back to his games?
Yes, all the time. Even after dinner, he puts his dishes in the sink and then he just wants to run upstairs to start gaming again.
Okay. And was this the case all his life in terms of, I know not gaming, but he was seeking refuge. He was seeking safety in sort of the computer. Was this a consistent pattern?
Yes. First it was the TV, and after that it was more and more the telephone and gaming, the computer game.
And what about you, Michael? What kind of relationship do you have, and how does the relationship be impacted by his gaming?
And now, when he's not gaming, he's quite a nice person with lots of humor. We play chess or something, or the holiday we play the pool with a ball. But then he gets distracted. I don't know what happened, but then it's something emotional, and he then want to go play his computer. It's more that he thinks it's obligation to spend time with the family, also during dinner, but always is the clock of gaming is running in his head.
Well, you know, this is very common in children who are on the autism spectrum. Your child may have milder autism, but children who have autism and are on the spectrum, plus with ADHD, which is a very common side effect of having autism and being on the spectrum, children who have these kind of issues, they're called neurodivergent issues, they need this constant stimulation and they need extrinsic motivation. You know, Kim, you said earlier to our producers that it's really hard to get him motivated on his own, intrinsic motivation. These kinds of children don't motivate themselves very well from inside. These children actually need a lot of external rewards and consequences. Now, this sounds completely opposite to conscious parenting because typically what I teach is that we should wait for the child to develop their internal motivation. We should wait for it to come from the inside. But in this case, this is conscious parenting for these kinds of children, meaning we need to understand that their brains function differently. It is said, and the research is out there, that these kinds of brains don't have the same supply of dopamine that a neurotypical brain has. Now, there's also dispute about this, so you have to fall on your own side on this issue. But if we go with that theory, and the evidence really is out there that these brains need more stimulation, they need the outside to reward them. They need the outside to provide feedback. They need the outside to provide that stimulation. Otherwise, they're going to go toward these games because these games are created to be addictive. They're created to give you the dopamine hit. Even us neurotypical brains love being on the screen. Why? Because it's dopamine after dopamine after dopamine, correct? The next thing that is very, very typical for people on the spectrum is that they need to feel safe in social situations. They're not the most social people. So gaming allows for an anonymous, safe community where they feel like they don't have to perform, they don't have to succeed. And the third thing that gaming provides these kinds of children in particular is it gives them this sense of success. And the way it does that is because it provides them constant motivation, constant feedback, right? There are dings and bings and bells and whistles and rewards and ladders and prizes and treasures. So guess what? That's what these kind of brains need to keep them on track. How can we help these kinds of children stay connected to the family, right? We have to get them to connect because otherwise they're going to have, internet gaming disorder or a screen addiction, and you're not going to know what to do after a few years. So what can parents do differently? Number one, realize that this brain is different. We have to treat this brain in a different way, with compassion, with understanding, but a lot of creativity. Number two, we need to provide connection, presence, feedback, and stimulation. Now, I'm not asking you to go and become a clown or an entertainer or a joker or jester, but we need to provide it for him. Meaning, after dinner, we know his trigger is, dinner's over. I don't want to sit around and talk. I want to run. They don't like to sit around and talk. Talking is the death of them. They need stimulation. So you need to, for example, set it up maybe 2 nights a week or 3 nights a week with a chess game already set up, or a fun board game already ready, or a quick darts game, or, hangman, anything fun, but right away. Because that after dinner, he doesn't like to sit around. He gets anxious. You see, too much talking, too much boredom creates anxiety in them. They need that dopamine. So if you understand the brain, you will understand how you can better connect with him. And of course, then once a week, you can always join him for a video game so that you're at least bonding. But I would say to you to be careful because this could become a red flag behavior. And what I mean by that is very soon, your child will not even want to leave the room, will not even want to come out to eat his dinner because he would have become a full-blown gaming addict. So we have to watch out for these behaviors and intervene early because before you know it, it can become self-harming and self-sabotaging, and they will not know how to function anymore. So you're watching it, you're seeing that right now it's an orange flag or a high yellow flag, but it could become a real red flag behavior. So I'm here to just caution you to create the boundaries. So let's talk about boundaries, because that's the other big part of this. Go ahead, Michael. What do you want to say?
When we're setting boundaries, it seems to me more like a sort of punishment issue. So it's difficult because there are consequences. Now you're not allowed to go into game, and then he is going to game. So we have to put off the internet, and it's quite childish. But how are we able to set boundaries without the struggle or the feeling of punishment?
I love that question. Thank you. So, boundaries are really difficult to implement if we don't fully believe in them. Because a boundary is not something you do to someone, it's something you are with someone. So for example, instead of keeping on telling the child to not eat the cookies, don't eat the cookies, don't eat the cookies, well, that's not going to work. We have to become the boundary so we don't bring the cookies home. You understand? Because we see that the child cannot keep the boundary. So similarly with your son, he's not going to voluntarily give up his screen addiction. He loves it. That's his safe place. That's his refuge, his escape from the world. So we need to become the boundary. And we become the boundary when we believe that what we're doing is truly for the best interest of everybody. So when you see that he's had his 2 hours of video game, I think that's enough. So if you truly believe that anything more is now going to harm him, is going to harm his brain, it's like, would you give your cancer patient something that would create more cancer? Would you give him a cigarette? No, because you see it's harming the brain. In the same way, I want you to become the boundary where you realize that anything more is harmful. When you believe that, you will turn it off, and he can believe anything. He can yell at you. He can scream at you. It's like the cancer patient saying, give me a cigarette, give me a cigarette. You're not going to give the cancer patient a cigarette, and you're not going to even feel bad about it, but they can be angry with you, and you're going to let them be angry with you. So when the parents believe in their boundary, then they stand firm in it. And even if the child is melting down, they don't feel guilty about it because they know they are protecting their child's well-being. So how much do you believe in your boundary? That's the question.
That's hard because it's the social context. It's not good for him, but it's also giving him a lot.
Okay, so let's go with that. Let's go with that because that's where you're getting confused. You're giving him 2 hours of gaming with his friends. How much do we need to be with these friends? And are they really friends? They're not. So you're giving them the hit of dopamine. You're giving them the hit of socialization. But that's not true connection, right? You and I know when we talk to someone online without seeing them, without being with them in person, that's not the same as real-time connection. Your son is 14 years old. You have the next 2 or 3 years for connection, for real physical connection. I would encourage you to capitalize on these last few years. Don't fall into the trap that is better than you. You are still better than anybody else out there. But what it takes from you is that you're going to have to be present, you see, because that brain that your child has cannot intrinsically create his own activities. So you need to help him, which means after dinner, and I'm only talking about 2, 3, 4 times a week. The rest of the time, he can go back. But can you make a commitment 3, 4 times a week to put aside the dishes, to put aside everything, and be present? Because that will rewire his brain and adjust to the rewards of being in real-time connection. There is no replacement for you. There's no replacement for real-time connection. So I'm just encouraging you to, yes, give him the games for that little hit of dopamine, but then you both need to step in because he's very young and it's too early for him to escape into his addiction. So what's coming up for you, Kim, as you hear this? Are you thinking, oh no, I'm going to have to do too much work?
No, I don't have to do too much work. We are already trying. I think 1 or 2 times a week, we are already playing a game before or after dinner or during dinner. It's going to be a hard one, but I'm really willing to do it.
Now, here's the thing. I do this with a lot of families because they don't want to be the bad guy. I often do it. And so I'm encouraging you to go to a coach. Let the coach set that new schedule where the coach tells him that this is not good for you. Hey, kid, you're 14 years old. You have already spent 2 hours a day, no more. And you and the coach and him together can create a schedule. Let him choose which 4 days of the week he will not go to gaming after dinner. That's a huge step. Let him choose which 4 days that is. Let him choose what kind of games to play or what he would like to do instead. But I think it's time to create a schedule and some boundaries because you're already giving him 2 hours a day before dinner. So don't be afraid to step in and connect with your children. You know, most of our children, especially teenagers, give off the feeling that the last people they want to hang out with is us. So we feel rejected. we feel like we don't want to fight, we don't want to struggle, so we give in to their screen time. But sadly, over a long period of time, and especially for children on the spectrum, then that will become their refuge. That will become their safe place. And then we're talking about dangerous levels of an addiction, because they will not be able to find that refuge outside, and they're going to feel afraid without that addiction. So we don't want it to reach that point. So that's why your flags right now are yellow and orange, but before you know it, they could become a vibrant red, and then it may be a bit too far gone. It's never too late, but it'll be even harder in 2 years. So this is your wake-up call. You came here for a reason. And I hope you can see why he goes towards it, but also see how you can create a surrogate, how you can be a different kind of parent around him.
Yes.
Certainly.
Clearly.
So what are the 2 takeaways you're going to take away from this talk that you're going to implement?
I'm first going to start with really feeling the boundary. When I feel the boundary, I'm going to set the boundary and let him choose which activities, and also try to create activities for him.
Tell me what you're going to do when he screams at you and tells you you're the worst parent and he's so angry. What are you going to do then? Because that's when it gets really sticky.
I think I'm going to set my mind on the future. So this is this for now. I'm not going to take it personal, and it's for the best for him, for his future.
Excellent. Beautiful. I wish you well. I wish you luck. I know it's not easy, but if you put in the work at the front end, I always say, then you will reap the rewards at the back end. So I'm so happy that this was helpful to you.
Thank you.
Thank you so much.
When our children display difficult behaviors, running away or lying to us or harming themselves, procrastinating too much, not seeming motivated, or in front of the screens too much, it raises a huge alarm within us. We panic, we get anxious, we get too controlling, we don't know what to do. I often tell parents that some behaviors are red flag behaviors for a reason. They are your children's way of saying, hey, mom and dad, step in, pay attention, I'm in trouble, I need help. If you're listening right now and your children are displaying some sort of extreme behavior where they're not functioning quite typically or like they used to, then don't be in denial about it. Don't just brush it under the rug, or don't just send them to get fixed. It's a family issue. It's a relationship issue. They are asking for you to be more connected, more present, more aware. You need to step in and maybe look for professional help. I always say when it comes to red flag behaviors, do not sit idle. Don't feel embarrassed or ashamed to get the help you need, because that's what your children need you to do. If this episode was helpful for you, and if you know of any parents out there who are struggling with their children's challenging behaviors, share it with them. And I will see you on the next episode of Parenting and You with me, Dr. Shefali. Parenting and You with Dr. Shefali is for educational and informational purposes only. It is not intended as a substitute for professional medical, psychological, psychotherapeutic, coaching, healthcare, or other qualified professional advice, diagnosis, or treatment.